What is the primary mode of action of clomiphene? A. Stimulates insulin release. B. Blocks excessive estrogen release. C. Inhibits sperm production. D. Enhances liver function. Correct answer is B. Blocks excessive estrogen release. Clomiphene blocks estrogen receptors in the hypothalamus, preventing negative feedback from circulating estrogen. This leads to increased release of gonadotropin-releasing hormone, stimulating pituitary release of follicle-stimulating hormone and luteinizing hormone, which promotes ovulation. What is the usual starting dose of clomiphene for inducing ovulation in women? A. 200 milligrams daily. B. 300 milligrams daily. C. 10 milligrams weekly. D. 50 to 100 milligrams daily. Correct answer is D. 50 to 100 milligrams daily. The recommended starting dose of clomiphene for ovulation induction is 50 to 100 milligrams daily for 5 days, typically beginning on day 3 to 5 of the menstrual cycle. Higher doses are not usually needed initially. How is clomiphene administered? A. Intravenous. B. Intramuscular. C. Oral. D. Subcutaneous. Correct answer is C. Oral. Clomiphene is administered orally because it is effective when absorbed through the gastrointestinal tract and convenient for outpatient use. Clomiphene should be discontinued if pregnancy does not occur after how many treatment courses? A. 3 courses. B. 6 courses. C. 9 courses. D. 12 courses. Correct answer is B. 6 courses. If pregnancy does not occur after 6 cycles of clomiphene, further treatment is unlikely to be beneficial and alternative approaches should be considered. Clomiphene is also known by which of the following names? A. Clomid. B. Progesterone. C. Estrogen. D. Metformin. Correct answer is A. Clomid. Clomiphene is commercially known as Clomid, a well-recognized brand name. A man with oligospermia takes clomiphene. What is the expected effect? A. Decreased sperm count. B. Increased spermatogenesis. C. No effect on sperm. D. Decreased libido. Correct answer B. Increased spermatogenesis. Clomiphene can increase gonadotropin secretion in men, which stimulates testosterone production and spermatogenesis, potentially improving sperm count in oligospermia. Which is not a contraindication to clomiphene therapy? A. Large ovarian cysts. B. Liver dysfunction. C. Amenorrhea. D. Undiagnosed uterine bleeding. Correct answer, C. Amenorrhea. Amenorrhea itself is not a contraindication. In fact, clomiphene is often used to induce ovulation in women with amenorrhea. However, large ovarian cysts, liver dysfunction, and undiagnosed uterine bleeding are contraindications due to safety concerns. Clomiphene blocks which hormone effect to increase ovulation? A. Prolactin. B. Estrogen. C. Progesterone. D. Testosterone. Correct answer B. Estrogen. Clomiphene blocks estrogen's negative feedback on the hypothalamus and pituitary, enhancing ovulation through increased gonadotropin release. What may excessive use of clomiphene cause? A. Pregnancy. B. Prolonged amenorrhea. C. Ovarian hyperstimulation. D. Weight gain. Correct answer C. Ovarian hyperstimulation. Prolonged or excessive clomiphene intake can cause ovarian hyperstimulation syndrome, a serious complication with enlarged ovaries and fluid imbalance. Which is a nurse's responsibility during clomiphene treatment? A. Monitor blood pressure. B. Ensure the patient is not pregnant. C. Advise increased alcohol use. D. Recommend prolonged therapy. Correct answer, B. Ensure the patient is not pregnant. Ensuring the patient is not pregnant before starting clomiphene is important because the drug is contraindicated in pregnancy and can harm a fetus. Great job making it to the end of Part 1. How many questions did you get correctly? Drop your score in the comment section below. I'd love to see how you did. In Part 2, we'll cover more clomiphene nursing questions and rationales, so make sure to subscribe and watch the next video right after this.